Hello everyone. Today we'll be discussing about the recent global threat about Zika virus. To start with, let us know what is Zika virus. It is a single-stranded RNA virus from genus Flavivirus, the same genus where the viruses like dengue, yellow fever, Japanese encephalitis and West Nile viruses belong. This is also can be called an arbovirus that can be transmitted through arthropod vectors like mosquitoes. The same mosquito, Aedes aegypti, is responsible for the transmission of Zika virus that transmits dengue. These mosquitoes reproduces and lays their egg in our domestic stagnant water, and they are aggressive daytime biters. Now let us look at the Zika virus transmission cycle. They have two distinct transmission cycles. Within the jungle, the sylvatic transmission cycle, where it gets transmitted to rhesus monkey from the mosquitoes. If that infected mosquito bites a human, then it comes into the urban cycle or its epidemic cycle. Let us look at the epidemiology of this virus. This virus is nothing new. It was first identified in 1947 in Uganda. In 1950, first came the report of human infection. After that, there was no cases reported. It was all quiet on the Western Front. In 2007, the first outbreak was reported in Yap Island. In 2013 and 14, again, 28,000 suspected cases were reported from French Polynesia. Now, in 2015 and 16, as we all know, it is all over in the media and news that Brazil has estimated 1.5 million cases of Zika virus transmission in the country. Not only Brazil, in 20 to 22 countries in South America and the related countries like Puerto Rico, Venezuela, all are having this transmission, and the transmission is spreading rapidly. Let us look at the modes of transmission. As we have already told, the primary transmission is through the mosquitoes, but other transmission mode like sexual transmission, maternal to fetal transmission, also transmission through breast milk is also being suspected. This is a completely new virus, so everything is under research and investigation. The risk group for this infection is distributed throughout the ages. All age groups are equally probable for getting infected. Next, let us look at the clinical symptoms of this particular Zika transmission. The symptoms are quite similar with the fevers like dengue and chikungunya. It has fever and rash, arthralgia, that is a sore joint, conjunctivitis, myalgia, headache, edema and vomiting, etc. Then how to distinguish these symptoms from other fevers like dengue and chikungunya? The main difference in symptoms that Zika virus fever has more manifestations of pink eye, that is conjunctivitis, and the rash than fevers. Fever is dominant in case of dengue and chikungunya, and in Zika virus fever, you will have more manifestation of pink eye and rashes. So that can be a primary mode of diagnosis for this kind of Zika virus fever. What are the complications associated with this particular Zika virus fever? As we have all seen in all over news and media, the potential link between a particular birth defect is being suspected in association with this particular fever. The birth defect is called microencephaly, where the newborns are born with a very small skull size as well as a very small brain that can cause a neurodevelopmental disorder in the later stage of their life. Another neurodevelopmental disorder called Guillain-Barré syndrome is also being suspected to be associated with this particular disease. Let us come to the diagnosis. The main problem with the diagnosis is there is no commercially available kit for the diagnosis. The general diagnostic procedure that is being followed for other viral diseases like RT-PCR to detect the viral RNA, the serological detection of IgM can be done, but IgM detection comes with a problem if the person is already infected with a related virus like dengue or have vaccinated for this kind of virus, then IgM can render a false positive result. You can confirm the viral infection more specifically with a plaque reduction neutralization test or immunohistochemical test for this virus. Next, coming into the treatment, there is no vaccination or medication available for this kind of fever till date. There are reports coming for clinical trials of vaccines for this disease. India-based biotech company has already claimed that they have patented the first Zika virus vaccine 9 months ago, but there is no confirmation for such news. So till date, let us hope that new vaccination or medication will come into way. Till then, we have to treat the symptoms like taking plenty of rest, drink fluids for preventing dehydration, and acetaminophen like drug can be taken to relieve fever and pain. But aspirin and other non-steroidal anti-inflammatory drugs are not to be taken until you rule out the possibility of dengue. There are already several guidelines and directives issued by different health organizations. CDC has long been issued the guidelines for preventing Zika transmission with a special reference to travelers and pregnant women. WHO also have issued an emergency alert in association with the Zika virus with the neurological disorder we have talked. And Government of India very recently have issued a guideline on preventing Zika virus transmission. Now the question is, why is it a threat to the world disease map? This is no fatal disease. Most of the cases patient have no fatal symptom or very prominent symptoms. But as we have talked about the association of this particular disease with the microencephaly, this is the major concern. If the disease spreads other part of the world, so this can be a major concern. So like we have failed for other epidemics earlier, like Ebola or SARS or dengue even, so we should be more careful from stopping this disease to spread. Already there are few news in the media and other channels that Brazilian government has told their women not to be pregnant till 2018, but there is no such official confirmation. This is a particular opinion of a specific health official from the Brazil. There is no such notification or alarming thing. So we need to be very careful in what we are having from the media or from the online platforms. So we really need to be careful if we want to prevent the disease. So with this concern, Docplexus has presented this very brief introduction on Zika virus transmission. Hope it will prove useful for you. For further discussion and comments, you can visit our site and we can continue our discussion on our platform. Thank you.